Can I do interoceptive exposure at home? Have you ever wondered if you can practice interoceptive exposure at home? This therapeutic technique is particularly useful for individuals dealing with post-traumatic stress disorder and anxiety, especially those who experience panic attacks. Interoceptive exposure helps people become less sensitive to physical sensations that can trigger distress. By safely recreating sensations like a racing heart or shortness of breath, individuals can learn to manage their fear and anxiety over time. While the concept of interoceptive exposure may sound straightforward, doing it effectively at home requires careful thought and consideration. First and foremost, it is highly recommended to seek professional guidance. A mental health professional trained in evidence-based therapies can provide tailored exercises and monitor your reactions. They can help you differentiate between normal anxiety responses and signs that indicate you may need to slow down or seek additional support. Attempting interoceptive exposure without professional oversight can pose risks, particularly for those with PTSD. Confronting intense physical sensations linked to trauma can sometimes heighten distress or trigger a relapse of symptoms. Without proper support, you might feel overwhelmed, which could worsen anxiety or PTSD symptoms instead of improving them. Typically, interoceptive exposure sessions under professional supervision may include exercises like spinning in a chair to induce dizziness, breathing through a straw to create a sensation of shortness of breath, or running in place to increase heart rate. The goal is to experience these sensations in a safe environment, learn that they are not harmful, and practice coping strategies to manage the anxiety they provoke. If you are considering trying interoceptive exposure at home, here are some important points to keep in mind. First, always consult a qualified mental health provider before starting any exercises. They can help you determine if this approach is suitable for your situation and guide you on how to proceed safely. If you receive the green light from your therapist, start slowly with less intense exercises and gradually increase the difficulty as you become more comfortable. It is crucial to monitor your reactions closely. Pay attention to how your body and mind respond during these exercises. If you feel overwhelmed at any point, stop the activity and reach out to your therapist for support. Stick to established techniques that are recognized in clinical practice, and consider combining interoceptive exposure with other therapeutic strategies, such as relaxation training or cognitive restructuring. For some individuals with PTSD and panic symptoms, carefully supervised interoceptive exposure can lead to significant reductions in fear and avoidance. However, the potential for increased distress means this technique is not suitable for everyone. It should never replace professional care. Always prioritize safety and seek personalized advice from a healthcare provider. In summary, while the idea of interoceptive exposure can be understood, and some basic exercises might be attempted at home, doing so without professional oversight is generally not recommended for individuals with PTSD. The safest and most effective approach is to work with a trained therapist who can tailor the treatment to your unique needs and monitor your progress. If you are interested in this technique, discuss it with your mental health provider to see how it might fit into your overall treatment plan.